Welcome to the Healthbeat Show. We have a wonderful show for you today. We are with none other than Dr. Nick. Dr. James Nicolopoulos, welcome to the Healthbeat Show.
Good to see you, Doc.
It's good to see you.
Here.
I can't think of having had a foot doctor on the Healthbeat Show for a long time. Wow. And we're really honored that you would be here because this is where it starts. It starts at the feet.
Starts at the feet.
Coming all the way up. Tell us a little bit about yourself. I'd like to let you know that I coined a little saying, Dr. Nick, the foot physician, he'll keep your feet in good condition. Oh, wow. So you're going to want to call your mom, your sister, your brothers, your friends, your athletes, your kids, because we're going to be talking about the feet today with Dr. Nick, the foot physician. He's going to keep your feet.
You have everything. Take my word, but I heard about the Healthbeat you're gonna be. I just wanna be. Show me how it will be. I just wanna be. Show me how. Listen to the show, the more you'll know about your health, soul, body, and mind. 'Cause the more
in good condition. Tell us a little bit about your background and your training. I mean, a foot doctor is a doctor. It's a foot physician. What's the schooling like, the training for a podiatrist?
Well, the schooling and training for a podiatrist is nowadays, when I went into it was a bachelor's, and then I went up to, I did a 4-year stint here at the Podiatry College in San Francisco, affiliated with UCSF, and then I went up to do a 2-year residency at UOW out of an osteopathic hospital, a surgical training, and sort of like a general podiatry residency also. So after those 2 years, I came back here and started practicing podiatry. So now the younger students that are starting have masters, and quite a few of them have PhDs. They do the 4 years, they do the 2-year residency. They're well trained with the new type of computers and analysis of motion. It's really exciting where it's going.
Mm-hmm. And a podiatrist is a doctor of podiatric medicine, a DPM.
Doctor of podiatric. In this state, we are physicians and surgeons of the foot.
Physicians and surgeons, and you do surgery. You said that you did a 2-year residency.
Surgical, right.
And in your residency, it mainly trains you to practice below the knee, so to speak.
Correct.
From the foot all the way up to the knee.
That's right.
And you are the one who is going to treat our nails, you're going to treat our heels, you're going to treat our arches, our ankles, the whole bit. You know, we think about even some of the athletes that I think about. One of the great wide receivers broke his ankle this past weekend, and he's not going to be able to play. So our feet mean so much to us. Tell us just a little bit about, as we talk about nails and fungus in the feet, athlete's foot. Well,
I kind of think that some of the fungus that we have in the nails is really somewhat genetic. I noticed that my father and some of my patients will have fungus, and then the wife will not have any fungus. Yet they're lived in the house for 60 years. They've been eating the same food. They use the same showers. So sometimes it's a genetic thing. Also, if not to say this is a bad thing, but if you go maybe to a pedicure and she starts to clean the cuticle back and she allows an air pocket to set, and then that air pocket allows moisture, for sure, you got your foot in a shoe that you close, it's dark, it's moist, the fungus will set in, and then once you get it in one, it'll go to the next one.
So then that leads me to another question. Is a fungal toenail something that you catch? Is it more common that you catch it like a cold, like you catch it from walking in the gym on the shower floor or at a beauty salon where they're working on your toenails? Or is it something more about the environment, maybe the body, maybe if you have diabetes or something that you're eating that's more important?
I would say it's probably a little of both. Our millennial type generation that kind of sits behind us, their hygiene's real good, but they didn't have to go to the war like my father did. My dad did a stint in the Philippines, and then he went to Germany. And my uncle stayed in the Philippines. He got fungal nails. My father got fungal nails. They wore that same boot for over a year. So it was, the hygiene wasn't as good as it could have been. They walked in muddy waters. They lived in, dirt and moist areas, and they rarely had a real true cleansing of their body to prevent this. But I see a lot of elderly having more fungus than the millennials do.
Yeah. And they tell people to try to wear light socks or let their feet breathe. What do you have to do when you look at these big nails that are curved, as you talk about sometimes in the older patients? Do you have to cut the nails off? Do you drill them and put medicine down in them? Do you laser them? What is the general treatment of choice?
The general treatment is, if the patient doesn't want to go on oral medication, for example, Lamisil, or if they don't want to go and get laser on each and every toenail, you just kind of keep them intact, so you could cut them, grind them. Once a fungus gets in the nail, it changes the entire architecture. So it not only grows long, but it also grows tall in height. So now you've got a nail that, now it's 1/4, 3/8 of an inch thick, and it's also growing long. And the reason it curves is that it's buttressed against the shoe. So then it makes the turn right around.
Oh, boy.
And if that patient doesn't have any discomfort, then they'll never have any discomfort.
And they get really hard and
very difficult.
Quite difficult. Well, we're talking with Dr. Nick. Dr. Nick is the foot physician. He's going to help keep your toes in good condition. Stay tuned. We'll be right back with Dr. Nick.
The Healthbeat Show, sponsored by Watson Wellness Water. Your health is your wealth.
If you have a business, product, or service and would like to advertise on Healthbeat, contact us. We feature affordable advertising for small, growing, and established businesses. Reach an accessible audience to over 4 million viewers. Promote the health and wealth of your business and give us a shot.
For advertising and sponsorship opportunities, log on to healthbeattv.info.
Hi, this is Dr. Nicolopoulos on the Healthbeat Show today, and this is your foot fetish time. So today, one of the most common things that happen in our feet is ingrown toenails. I think everybody's had one. There probably hasn't been a time that you haven't had one. One of the reasons why you have one is that you've probably been cutting your nails incorrectly, and you're digging down a little bit too deep down the medial or lateral border of that nail, and then you leave a little spicule. And all of a sudden, within 24 to 48 hours, you got a red hot swollen toe. That's when you call your podiatrist, you go see him, he gives you a little Novocaine, he cleans out the border of the nail, and he resolves that problem once and forever. This is James Nicolopoulos with your foot fetish segment, and let's get back to Dr. Jeffrey Watson on the Healthbeat.
When I was 6, my days were spent playing basketball. When I was 6, my dream was to make it to the NBA. When I was 6, my mom had a stroke. I'm Paul George, and I want you to spot a stroke fast. F, face drooping. A, arm weakness. S, speech difficulty. T, time to call 911. Protect the ones you love. Spot a stroke fast.
I'm Dr. Jeffrey Watson. We're right back here with Dr. Nick. Dr. Nick is the foot physician. You're going to see him regularly on the Healthbeat show because, you know, you'll always hear me say that I want you to be healthy from your nose all the way down to your toes. And Dr. Nick is helping us to do that when we talk about our feet. It really starts with the feet. I asked you a question just a moment ago about athletes' foot or toe infections, fungal infections. We know that sometimes people even get infections between the toes with fungus. But what about, as we talk about the millennium, the younger people, the athlete's foot, the person that wants to exercise, that wants to be an athlete, that wants to play basketball, run track, football? What about those feet? I mean, we've got these shoes that are out there nowadays. They're so expensive. They look good, they're pretty cool, but are they really good for your feet? And what kind of shoe should an athlete look for?
Well, you know, every athlete will be looking for a different type of shoe. A 100-meter runner will be looking probably for it's almost like a slipper with a set of cleats in front.
Mm-hmm.
A football player will be looking for a stable shoe with cleats in the front and the rear. A long-distance runner will be looking for more of just a good, solid tennis shoe where he could do some long-distance running. But all these shoes have one thing in common: stability.
Mm-hmm.
And they need to be tied tight. Today's youngsters come through the door and they talk about their heel pain, they talk about their foot's aching all the time, their parents bring them in, and I could see the shoelaces are just not tied and their foot is going. So every step they take, they're taking really 3 steps, and they're wearing their foot out. So that's why I tell them, tie your shoes tight, wear something supportive in the arch, and you'll be fine. You won't be coming to visit me. And it's simple as that.
You know, you talked about the arch. We were talking off air. You know, here in the foot, you've got the heel, and you could explain this much better than me, of course. You've got the heel, you've got the arch, and then you've got the forefoot, so to speak. And is it supposed to be that everyone has an arch in their foot? Is everyone supposed to have that, or are some people supposed to? Is it okay, particularly if you're an athlete? Is it okay to have flat feet?
Exactly. Some of the best runners, the first 5 steps, have flat feet because the surface area of their foot is down. It's completely on the ground, and they can make cuts where the first person with a high arch, they don't have that ability. Now maybe they're as quick and it's fast, but they can't make that maneuver. And that ability, that foot that's completely down, he has a complete control of his body and his axis on what direction and how quick he'll make that turn.
That's interesting. And then you have the person, I know this happened to me. I was running and my heel was hitting the ground first. You know, I was trying to do distance kind of running, and eventually my heel started to hurt. And when I got an x-ray, it looked like I had a pin sticking out of my heel.
You had a heel spur.
That's a heel spur.
Right.
Was that a broken bone, or what happened?
What happens is the plantar fascia that goes all the way from here and all the way back to the heel starts to give. And when it gives, it's like let's call it a 3/8 inch belt. And it attaches here, and as the arch drops, it's not going to tear, but it'll pull the bone away. So on x-ray, when you take that x-ray, boom, you'll see that point. And you'll say, oh, the point's killing me. No, it's not. It's where the plantar fascia meets the bone, and that area is really inflamed. And it causes a lot of problems, and it hurts. And the first step in the morning, you know.
Oh, it hurts so bad.
Like there's nobody's business.
I thought I was 100 years older than I am. I mean, I couldn't hardly put my foot on the floor.
To solve the symptom, quick shot of cortisone. To solve the problem, a nice pair of arch supports, never have the problem again.
How about a heel cup? I bought some heel cups. Are those?
That's a symptom problem. That just cushions the heel.
Oh.
The real problem, the real solution is to hold the arch.
So I should get a
pair of arch supports.
A pair of arch supports.
Right.
And you can, some of the tennis shoes now have the arch supports in them.
Built right in them.
Right in there, huh?
Built right in.
And the heel is cushioned a little bit.
Correct. The way to go when you buy a pair of supports or over the counter or you go get a custom, if you don't feel that arch support in your arch, that's not enough arch. It has to be lifted up until you actually feel that you're cradled right on that support.
All right, now here's the question that I know the ladies want to know about. High heels. I love high heels. I love to see ladies in high heels. We're going to be right back with Dr. Nick, the foot physician. He's going to keep your feet in good condition. Stay tuned. We'll be right back.
The Healthbeat Show, sponsored by Watson Wellness Water. Your health is your wealth.
I guess sometimes things just happen. Devastating things. Your whole world changes in an instant. That's what happened to me the day my mother had a stroke. I'm Paul George, and I want you to spot a stroke fast. F, face drooping. A, arm weakness. S, speech difficulty. T, time to call 911. Protect the ones you love. Spot a stroke fast.
Hi, this is James Nicolopoulos on the Healthbeat Show with Dr. Jeffrey Watson. This is our segment called the Foot Fetish. I spoke a little earlier this week, talked to you folks about how my practice had changed, and it's that I see more patients on the outside. Well, one of the difficulties on seeing patients on the outside is follow-up care. If I drive to Modesto, if I drive to Tracy, if I drive to San Jose, or if I drive to San Francisco, it's difficult for me to follow up on a patient who may have an infection. So what I do is I call a reliable home health agency and make sure that a nurse goes and follows up on that particular infection, that ulcer, or whatever it may be. And without that there's no way in the world I could provide a good level of care without someone following up. These nurses go out, they're trained to take care of patients in their home or in their environment. They're very helpful, and without them, I couldn't see maybe 100 patients a week without them.
If you have a business product or service and would like to advertise on Healthbeat, contact us. We feature affordable advertising for small, growing, and established businesses. Reach an accessible audience to over 4 million viewers. Promote the health and wealth of your business and give us a shot.
For advertising and sponsorship opportunities, log on to healthbeattv.info.
I'm Dr. Jeffrey Watson. We're right here on the Healthbeat Show. You'll always hear me say that we will talk to you from your nose to your toes and all the issues in between. Today we're talking about your feet. We have with us none other than Dr. James Nicolopoulos. We call him Dr. Nick. He keeps your feet in good condition because he's a foot physician. So we're talking some about high heels. Now, high heels look so nice on women. They're expensive. The ladies, I mean, some ladies have so many pairs of high heels, and they wear them all the time. They love to wear them. How does that affect the foot? Is it okay? I like the way it seems to make the leg shape and the behind shape a little bit. Does all that come from the position of the foot?
Correct. It does. It makes the foot look slender, makes the foot look more attractive, and the leg look more attractive. The downside to it is that when a woman is in a 2-inch heel, she's putting 75% of her weight on her forefoot. That means that she's not putting any weight here, none there. It's all going to her forefoot. And if she's predisposed to bunions or hammer toes, she's going to have nothing but trouble.
What's a bunion?
Bunion here is just an overgrowth of this particular area right here at the first metatarsal phalangeal joint, and it seems to get really large. It's hard to put into a high heel. And if a woman's going to wear a high heel and she has a bunion, she has to wear a thin leather upper. She cannot wear man-made materials. Man-made materials on the uppers, when they get warm, they shrink. And then the bunion even hurts more.
So up on the top of the shoe, they should not wear.
They should not wear man-made materials. On the bottom, it could be a man-made material, but up on the top, that Italian thin leather, when you put your foot, it's like a glove. You put your foot into it, it adapts to it the minute you put your foot into it. And then it just customizes to your
So that's
shape.
a soft thing. That's a good thing to do.
That's a good thing.
But the bad thing would be something that's tight and holds on. Because their toes bend sometimes.
Right, right. And you know, the inexpensive shoe actually causes more difficulty because, like I said, the man-made material, after an hour in there, it heats up and it shrinks. And then the woman's really in a lot of pain.
Mm-hmm. So are the expensive high heels made out of these fancy leathers, are they really better or they just look better?
They don't hurt as much. They look just as good.
Okay. We're with Dr. Nick, the foot physician. We're talking about keeping your feet in good condition. We've talked some about fungal toenails. We talked about the arch. We talked about the heel.
That's
We've
right.
talked about plantar fasciitis. What about the ankle? You know, now I have lots of patients that have injured their ankles. And I see here we've got this skeleton bone and we've got all these tendons in the ankle. Sometimes the patients tell me if they've broken their ankle that they have to have surgery where pins are placed in the ankle.
Correct.
That just, that's a controversial thing for me who has to take care of them later down the road. What's your thought about good ankle care?
Well, good ankle care really starts with with good foot care. So if you wear a stable shoe and you wear a supportive shoe, your ankles will just fall in alignment. We've got 26 bones right here just in the foot alone. And between both the right and left foot, that's over 25% of the bones we have in our body. We've got 33 joints, 26 bones, so it's really imperative. Keep your arch up if you have a high arch, because if you have a high arch, it's going to go down. So it's imperative to take care of that arch, wear stable shoes. While you're moving and running around, be sure that the shoe's tied nice and firm. It seems that the young people nowadays just love loose shoes, and it just gives them nothing but trouble. They'll be suffering from arthritis and difficulty ambulating when they get to be 20, 25 years old. And they'll be saying, gee, I'm a young person, I still have trouble.
Are high tops sometimes beneficial?
Especially for the very unstable foot and also the unstable ankle, yes.
What's your thought about when people have to have the surgery getting the pins in there? I mean, I know sometimes they have to have the pins for stability. If they do get them in there, the question often comes to me, the pins hurt, should I have them taken out? Now that's a whole nother surgical procedure. Do you have any thoughts about that?
Well, you know, their PCP, if they're in good health, those pins do hurt. And those pins, after a while, they get to move around and they're not as stable as they should be over maybe a 10 or 15 year period. So if they're in good health and they have a lot of pain, and I define pain as it's probably 80% of a month. So if you've got 24 days of pain, then that warrants to go ahead and have them removed if they're in good health. That's where you come in. You make that decision, your heart, your kidneys, your lung, because some of them might not be a local anesthesia standby procedure. It might be a general. So
could be somewhat of a serious procedure.
Right.
Now here's one last question. Is it better to put your feet down in a cold bucket of ice or put it down in a warm bucket of water? If you're trying to keep them from hurting, your ankles hurting and your feet from hurting in the afternoon when you come home from a long day of work.
The warm water makes it feel really good. But in reality, the ice will reduce the swelling, reduce the inflammation. If there's additional fluid floating around the ankle or on the medial or lateral aspect, it'll help reduce it. The warm water will make the foot swell more. It'll make the tendons swell more. And in reality, you're just going backwards. Best to hit the ice. Ice, ice, and ice.
And that's cold. I've done that before.
That's real cold.
It's hard to do, but I think you're probably right. It's going to keep the inflammation out, keep the swelling down, and most people don't think of that. They think of putting their feet in some warm water.
Right.
I love to do it. Generally, it seems in your brain like it's good, but later, if you're trying to get that inflammation down, I think the ice is going to do better.
Right.
We've heard it all here today from Dr. Nick. He is the foot physician. He's going to help us to keep our feet in good condition. We hope to hear from you on a regular basis, Dr. Nick. Keep us up with all that you're doing and all that we can do to keep our feet healthy.
I'm glad to be here and enjoyed our time. Thank you so much.
All right. We'll see you next time. I'm Dr. Jeffrey Watson. Remember always that your health is your wealth, and when you have your health, you have everything. We'll see you next time.
The Healthbeat Show, sponsored by Watson Wellness Water. Your health is your wealth.
So they say it's a man's world? I don't see anybody's name on it.
While they were doing their thing, we slowly changed all that.
Today, women can do anything men can do. And there's one thing we're even better at.
I'm Dr. Jeffrey Watson. Thanks for being with us on this episode of the Healthbeat Show, where we try to educate you about different aspects of healthcare, about eating right, exercising right, what you can do to help yourself, how to access the healthcare system, what kind of questions to ask, what you should do for any particular disease state. Because I always believe that your health is your wealth, and when you have your health, you have everything. I'm Dr. Jeffrey Watson. We'll see you next time.
My word, but I heard about the Healthbeat. You're gonna be how you wanna be. Show me how you will be. How you wanna be. Show me how you will be. Listen to the show. The more you'll know about your health, so body and mind. 'Cause the more you know, your life will show you.